This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Manager of Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning, Trinidad and Tobago. Thank you for joining us at the Ministry of Health's virtual media conference on the COVID-19 response. Today we have with us Senator the Honorable Dr. Amory Brown, Minister of Foreign and CARICOM Affairs, Dr. Roshan Parasram, Chief Medical Officer, and Dr. Avery Hines, Technical Director of the Epidemiology Division. I am Candice Alcantara, Manager of Corporate Communication for the Ministry of Health, and I will moderate this morning's media conference. We begin with a clinical update from Dr. Parasram and some additional information on the importance of immunization.
Hi, good morning. Thanks, Ms. Alcantara. Morning, Honorable Minister of Foreign Affairs. Morning to Dr. Hines and members of the media, members of the viewing and listening public. So I'll begin with the usual clinical update for February 23, 2021. So total number of tests conducted, public and private, are now at 95,342. Our positives over the last 24 hours are 4, taking our total up since March 12 to 7,686, with a total number of recovered patients standing at 7,423, leaving our active cases now at 124, with 139 deaths during that period. Our total persons in home isolation are at 107, and those in step down now at 1. Total patients in state quarantine are 295. With regards to our hospital, we have at the Hoover Hospital and Multi-Training Facility 12 persons. 3 of those are now in the ICU, and in terms of the step down, that 1 person is at the UE Debe campus. With regards to our quarantine sites, we have persons spread among a number of sites at the Chancellor Hotel 1, Cascadia Hotel 25, Regent Star 18, Paria Suites 14, Debe Halls 8, UE Canada Hall 45, UE Freedom Hall 11, Cara Suite 17, Keepak Hotel 54, Napa Hotel 29, and at the Trade Winds there are 21 individuals. So I just wanted to begin the discussion based on a press release that was sent out yesterday regarding an update. The public urged to ensure that they are vaccinated against yellow fever. So the Ministry of Health, through its Insect Vector Control Division, along with the Veterinary Public Health Department, continuously assesses and engages in surveillance for diseased or deceased red howler monkeys in particular in the forested areas. And this has been going on for many, many years, for decades. So what we have noticed is over the past couple months, there has been an increase in the number of deaths of these animals within certain districts in the southern region, in particular the Plomitan and the beach areas and adjacent areas. And it is there's a contiguous forested area going all the way to Rio Claro, in which we see and have cited in the recent weeks those animals coming to the fore out of the forest, usually a sign of illness, and of course having some deceased animals. So we would have taken those samples last week of 1 red howler carcass to the Veterinary Public Health Lab, and having done a necropsy on that animal, it would have been highly suggestive of yellow fever. Thereafter, we would have taken a sample, which was sent to our Caribbean Public Health Agency lab, and they tested that, and yesterday they actually returned a positive for yellow fever to us. Now, yellow fever, it is a disease of the arboviral family. It is a flavivirus, and it is transmitted through the bite of an infected Aedes aegypti or Haemococcus mosquito from one person or one animal to a person. So it is a vector-borne disease in that regard. And what it means for us to find a positive animal with yellow fever in the country is that we need to be on heightened alert. And what we have to do as a population is ensure that we do have our vaccination for yellow fever. Generally speaking, yellow fever is a disease that is covered in our childhood immunization schedule. and therefore at 1 year of age you would get your vaccine for yellow fever. Once you have that single dose, it will cover you for life. You don't have to have a repeat dose. There's new guidelines that suggested that in 2013 from the SAGE group of WHO, that once you have one dose, it will be protecting you for life. What we are calling upon are persons that would be at particular risk of actually going into the forested areas. So these persons would include veterinary personnel, laboratory workers who routinely handle the wild-type yellow virus, for example, agricultural personnel who frequent forested areas, hunters, forest workers, adventure seekers, defense force personnel, persons residing in or near forested areas, healthcare workers that frequent these areas, and anyone who has reason to go into those areas. So the two things we want you to do: one, have your vaccines for yellow fever. So you're going to examine your card, see when you would have had it. Once you have one dose, you are protected for life. And of course, if you have to go into those areas, ensure that you're vaccinated. And also, as an added protection, ensure that you do the personal protective measures related to vector control for mosquito bites, using your insect repellent, wearing long sleeve clothing to prevent bites, as well as taking any other precautions as you see necessary at that point in time. The Honourable Minister would have asked to mention we would have had a continuous call during last year's press conference, noting fully well that persons not attending face-to-face classes would now not have that level of scrutiny put on them for examination of your cards. And what we have noted for yellow fever, for example, is that our coverage rate in the country has gone down over the 2020 period. So in 2019, our coverage would have been 98%. WHO, that is at a national level. WHO requires 95% at a national level for us to protect our population sufficiently. We have gone down to 89.2% with regards to yellow fever, and we are calling on parents in particular to take your children into the health centers to be vaccinated to ensure that our coverage gets back up to that 95%. Nationally, we are at 89.2%. However, in certain counties, we have achieved our 95% targets. So certain counties have gone beyond 95% and are well protected. But in certain little pockets of the population, there are coverage rates less than 95%, and we need to work with the particular jurisdictions through the DHVs to get that number where we need it to be in the shortest possible period of time. So just a last word in terms of our vaccine, COVID-19 vaccine now. So just switching a little bit in terms of updates. So as you know, so far, we have had bilateral talks going on since October 1st. We have the COVAX facility, which we had signed the agreement on September 18th of 2020. We noted that the first country around the world, Ghana, has received the first shipment of 600,000 doses of vaccines out of the COVAX facility. Having discussion with PAHO up to this morning, PAHO has indicated that within the next 2 days or so, Trinidad will know the actual date that we'll be receiving our first tranche, which is between 108 to 117 doses of the AstraZeneca vaccine. 108 to 117,000 doses. And that represents a portion of the first 20%. The first 20%, as just to remind everyone, the first 20% is scheduled to be delivered somewhere within 2021, and that will account for 559,600 doses. And overall, in terms of the COVAX facility, we have signed up for 923,340 doses. Outside of that, we have an agreement with the African Medical Council, which has been mentioned before, and it's a similar to COVAX sort of arrangement where we have signed up as well for 226,000 doses of the COVID-19 vaccine. So, Candice, that's my brief update for this morning.
Thank you very much, CMO, and thank you for that very important reminder about vaccination. Please ensure that you are vaccinated and that your loved ones are well vaccinated as well, especially our children. We go now to the epidemiological update from Dr. Avery Hines.
Thank you, Ms. Alcantara. Good morning to the Honourable Minister, Amory Brown. Good morning to the CMO, members of the media, members of the viewing and listening public. Please may I have the first slide. We'll go relatively quickly through the brief epidemiological update. Now, what we've done with this, the epi curve or the epidemic curve, is we have taken all of the data from the end of July going into the start of August, all the way down to the current date, and we're just looking at that in one color. And the reason we're doing that today is so we can see the overall trend, where we've been down to where we are now. The blue lines, those blue bars, indicating daily cases, as in the number of cases that would have presented on a given day. And we see that overall downward trend mirrored by the black dotted line, which is the rolling average over a 7-day period. And we see that we're now down to single-digit rolling averages over the last possibly about 3 weeks or so, which is an encouraging sign that what we are currently doing, the measures that we are currently undertaking, are having the desired effect. It is also encouragement to hold the course with respect to these measures, even as we prepare to enhance the population's protection through the vaccination program. Next slide, please. The demographics for the number of cases remains relatively similar, almost 50-50 in terms of men and women infected, and more than 55% of the individuals infected being within that 25 to 49-year-old age group, representing mostly the active working population. We see the smaller numbers at the bottom of the pyramid representing essentially the school-aged population, that is everyone under 19. And we see that that narrowing of the pyramid reflects the fact that we have managed to protect that population, that demographic, but we are currently monitoring the 15 to 19 age group in particular, as we have increased mobility among that demographic as they go back out to school. The forms 4, 5, and 6 individuals who are now moving around a little more, therefore a little more exposed, but at this point they're exposed to a population with lower levels of circulating virus, and we hope that with all the care that they are taking to adhere to the public health measures, there won't be changes within that demographic. We continue to observe, especially in this week, as the 2-week sort of trial period, that 2-week period between them coming out and any potential changes in their demographic. That period has come to an end, so we're looking very carefully this week at what's happening there. Next slide, please. With regard to the deaths, we see that 3-to-1 pattern that we have noted throughout our epidemic of approximately 75% men to 25% women, 2/3 of the individuals who have passed on being above 60 years of age. But there have been deaths in the younger age groups, and one of the most common recurring risk factors for an adverse outcome is the presence of other diseases, chronic diseases, what we call comorbidities, including hypertension, diabetes, treatment for some malignancies, kidney disease, a range of things that impair your body's response to this new coronavirus threat. And last but not least, next slide, looking at the distribution, we do see that the distribution on the map again reflects those lower numbers throughout the country. The legend, that is the colored squares on the right, or colored rectangles on the right, showing that the largest number of cases in a given community was actually 6, and that was in San Fernando proper. The other communities have had small numbers of cases over the past 2 weeks, and we are encouraging all populations in all places to continue what they're doing with respect to the hygiene, the physical distancing, the mask wearing, avoidance of crowds, or avoidance of mixing and socializing when you are ill, as it is having the effect that is desired and is necessary of reducing the risk and the rates of transmission throughout the population. That brings me briefly to the end of the epidemiologic update. I'll turn you back over to Ms. Alcantara.
Thank you very much, Dr. Hines. And we go back to the Chief Medical Officer just to reinforce some key points as it relates to the yellow fever vaccine.
Yeah, just to underscore, at this time we have no human cases of yellow fever in Trinidad or Tobago. We haven't had a case of yellow fever since 1979. So we have no human cases, we have no epidemic of yellow fever. We have noticed an epizootic, which is an increase in the number of disease in an animal population occurring in 2 sites. We have enough vaccinations. We have actually 105,400 vaccines of yellow fever available for the population to be vaccinated. Thanks, Ms. Alcantara.
Thank you very much, CMO. And I will now introduce an audio podcast from the BBC World Business Report entitled COVID-19 Vaccines. How can developing nations get a fair share? And it highlights an interview with Dr. Kamal Yani. We go now to the podcast.
Here, when talking about the promise of vaccines are kind of becoming a reality, we've been hearing nobody's safe until everybody's safe, vaccine equality, all wonderful talks, but really when it comes to the reality, we talk about different planets. So what we're hearing now from the G7s and a few others is that they're going to donate the excess vaccines that they have to, or that they will have, to developing countries. Well, you know, this is, okay, it's a temporary measure, but we have no idea what volume we're talking about. We have no idea when they're going to donate, what they're going to donate, after how, you know, what percentage of the population they're going to vaccinate. So, for example, in the UK and the US, we're talking about vaccinating the majority of the population by the fall. Should the African countries wait until then, or what? We're not going to achieve control of the virus if the virus is left to run around, as it were, in the rest of the world, mutating and doing whatever it likes.
What would be a more sustainable solution in your view? We've heard a moment ago the suggestion, for example, that the pharmaceutical manufacturers could give up their intellectual property and give the recipes of these vaccines to manufacturers around the world so it can be produced on a massively more widespread scale.
No, nobody's really talking about the real problems. This is not an ideological debate about the role of pharmaceutical companies. This is about the reality. The reality is we're lacking supply. We don't have, when I say we, I mean globally, we don't have enough doses. Look at the problem that happened in the EU. So how do you deal with this lack of supply? The fact is, it's like we are, you know, these countries are fighting for a share of a small pie, a very small pie. So the big guys are snatching basically big shares and leaving crumbs for developing countries. The answer is expand the pie, increase the pie, make it absolutely the maximum pie that you can get hold of and get everybody a fair share. That can happen by enabling all potential vaccine manufacturers in the whole world to produce these vaccines. And that happens by sharing technology, the know-how, and not worrying about intellectual property rights. The alternative to that is what's happening now. Business as usual, the main decisions on production, supply, when you deliver, to whom you deliver, at what price, all these fundamental decisions are in the hands of pharmaceutical companies. This is just really, I mean, what do I say? It's a stupid way of running global business or running global health, really.
And leading off from that audio file, we go now to a presentation from Senator the Honorable Dr. Amory Brown, Minister of Foreign and CARICOM Affairs, and he will address the role of that ministry in the acquisition of COVID-19 vaccines.
Thank you very much, Madam Chair. I want to recognize the Chief Medical Officer of Trinidad and Tobago, Dr. Paras Ram, Dr. Avery Hines, the Technical Director of the Epidemiology Unit, Ms. Candice Alcantara, the Manager of Corporate Communications, the Ministry of Health, members of the media, and of course, citizens of Trinidad and Tobago who have been paying close attention to these media updates. I want to start by commending the Ministry of Health, the Minister and his team for what has been an exemplary and exceptional management of the COVID-19 situation in Trinidad and Tobago. And I took careful note of the epi-curve as demonstrated by Dr. Hines, and recognizing that we are rolling with an average of about 4 new cases per day, which is exceptional within the region and across the globe. Exceptional. So I want to begin with that point. I also want to recognize that almost 6 months ago, in September 2020, this country signed a formal agreement with COVAX for substantial supply of vaccines on behalf of all the people of this country. And that agreement still stands. That agreement will be honored. And that agreement, the first tranche of supply, is expected within the next several weeks. So that is a point that I think is being missed at times by the coverage of this situation. And it is not as if Trinidad and Tobago is without a committed supply of COVID-19 vaccines. In fact, quite the opposite is the case. And in the very near future, we are anticipating the first supply of WHO-approved vaccines for the people of Trinidad and Tobago. And of course, this comes on the heels of the 2,000 doses that have been generously gifted by the government and people of Barbados. In addition, we have another significant confirmed supply via the African Union of over 200,000 doses that has already been arranged, and we are anticipating an update with respect to the estimated dates of arrival of those vaccines within our region and for Trinidad and Tobago. So I just wanted to begin with that particular background. Back in September 2020, this country signed the formal agreement with COVAX for up to 900,000 doses of approved vaccine. Since then, the Ministry of Health has been engaged in significant bilateral discussions with companies. I just want to make the point very clear that COVID-19 vaccines are not being manufactured by countries or states or governments. It is by and large by the private sector. So the discussions being held by the Ministry of Health, the procurement efforts being led by and conducted by the Ministry of Health have been with the private sector, with manufacturers and potential distributors of this particular vaccine. More recently, the Ministry of Health has sought the support and involvement of the Ministry of Foreign and CARICOM Affairs as the COVID-19 vaccine access challenge has intensified. It is a matter of public record that a number of large countries have been vacuuming up supplies of available vaccine, and there is a sense of challenge with respect to access by developing countries around the world toward approved vaccine. In fact, the latest update from UNESCO indicates that 150 countries around the world have yet to receive a single dose of vaccine. So in 150 countries, there is no vaccine whatsoever as yet available. But we need to bear in mind we are in the relatively early days of vaccine access across the road. Unfortunately, it has not materialized in these early days in the equitable manner that was at first envisioned, just due to where the resources are heavily located. As part of its mandate, the Ministry of Foreign and CARICOM Affairs acts as the liaison between the government of Trinidad and Tobago and foreign governments with respect to bridging gaps, building relationships, and intervening on matters of importance to the government and people of Trinidad and Tobago. With respect to the COVID-19 pandemic, and specifically with respect to the government's efforts to procure WHO-approved vaccines, the Ministry of Foreign and CARICOM Affairs has been quite active in playing a supporting role to the Ministry of Health in finding ways for the government to achieve its goals, guided by stated needs and parameters, as has been articulated by the Minister of Health and his team, where the technical expertise resides. So the procuring agency is, for this vaccine, for other vaccines, for all medications and medical supplies, is the Ministry of Health. The supporting role is currently being played by the Ministry of Foreign and CARICOM Affairs. As has already been stated and as is part of the public record, the government is guided by the WHO's regulatory approval of any vaccine, and as such, the outreach by the Ministry of Foreign and CARICOM Affairs has been influenced by this particular criterion. I want to turn briefly to the arrangements for the purchase of vaccine from Indian sources, which has been the subject of some attention by elements within the media. The facts of the matter are that the CARICOM Secretariat informed CARICOM member states on the 4th of February that there was an offer made by a manufacturer, a private sector manufacturer in India, for the opportunity to purchase a vaccine called Covaxin. I want to clarify that to this date, Covaxin has not achieved WHO approval, and there was the opportunity to sell Covaxin to CARICOM member states. This information was immediately passed on by our ministry to the Ministry of Health. In response, the Ministry of Health sought CARICOM and Foreign Affairs assistance to engage the Indian High Commission toward the purchase of Covishield, because the information at that time is that Covishield was impending for approval by the WHO. In fact, the Ministry of Health was correct. Covishield, which was a different vaccine, achieved this approval on the 15th of February 2021. We conveyed the relevant information to the High Commission of India based on the Ministry of Health's request. That was reinforced by my correspondence, written correspondence with my counterpart in India, the Minister of External Affairs, and more recently, the Prime Minister of Trinidad and Tobago has corresponded with the Prime Minister of India, all with regard to our efforts to broaden the scope of vaccine availability beyond COVAX, beyond the African Union, looking for additional sources. There were some challenges with establishing communication with the Serum Institute, which is the manufacturer of this Covishield vaccine in India. The Indian High Commission has been very open and has continued a very warm engagement with us in the government of Trinidad and Tobago. And they've clarified that the government of India is in a position to assist with the export of vaccines to our country, but the purchase agreement and the purchase order must be made. It's not made with the government, it's made with the private sector, with the Serum Institute. There were some difficulties in communicating with the Serum Institute, and we sought the assistance of our High Commissioner in Delhi, who was successful. High Commissioner Roger Gopal was successful in reaching the Serum Institute, and unfortunately the response from them, the private sector entity, was that the Serum Institute is not in a position to accept any further orders for vaccine at this time. I met subsequently with the High Commissioner of India and conveyed all of this information, and I just want to make it clear that the government of India has indicated to us that they will take all available measures, quote unquote, they will go the extra mile in an effort to secure the provision of Covishield vaccines for Trinidad and Tobago. Those discussions are ongoing, and as I said, the Prime Minister has corresponded with the Prime Minister of India on this matter. So I just want to debunk any attempt to put out there a sense that there's any reluctance to accept or purchase vaccines from India. That is absolutely not the case. In fact, the Ministry of Health would be quite clear that many of the medications and vaccines currently used in this country come from, India is a powerhouse of medical supply and vaccine supply. With respect to these new vaccines, the basic conditionality is that we must have WHO approval before we can engage in any formal arrangement, and that is currently in place. I just want to close by indicating that these broader efforts being engaged by the ministry are not limited to just one country. We have also had discussion and meetings with representatives of other states. I've met with the ambassador of Germany. I've met with the ambassador of France. I've had extensive discussion with the High Commissioner of Canada. And the broad-ranging efforts are ongoing on behalf of the Ministry of Foreign and CARICOM Affairs in support the Ministry of Health's efforts to procure vaccine supply, approved vaccine supply, for the people of this country. I want to end by stating that as we speak, right at this time, the Prime Minister of Trinidad and Tobago is chairing the 32nd Intersessional Heads of Government meeting of the Caribbean Community of CARICOM. And the item of business currently under discussion, 1 hour and 20 minutes have been dedicated at that heads meeting specifically to discuss COVID-19 and the current challenge faced by the community in accessing sufficient vaccine for all our people. It's currently under deliberation, and an update is expected from PAHO and CARFA at that particular meeting. So that's going on simultaneously. And it comes on the heels of the Prime Minister's collaboration with the Director General of the World Health Organization in sending a signal to the globe that there is a challenge that all countries must rise to this challenge, particularly countries with greater resources, in ensuring that more equitable access to COVID-19 vaccines can materialize, not just for Trinidad and Tobago, and even beyond CARICOM, for all developing peoples around the world. With that, I thank you, and we are available for questions.
Thank you very much, Minister, for that very important clarification. And we begin the question and answer segment now. I invite media representatives to please indicate your name and the media house that you represent before posing. Please 2 brief questions, maximum of 2 brief questions. We will, of course, come back to you if possible. And we begin with questions from Newsday this morning.
Hi, good morning. This is Paula Lindo from the Newsday. I wanted to go back to the start of the press and ask the CMO for people who don't have their vaccination cards, should they go and get vaccinated again? And for the older people who would have gotten vaccinated many years ago, would the lifetime coverage apply, or should they still, as a precaution, go back and get vaccinated for yellow fever? Another question I have is, now that vaccinations have become worldwide, if someone has received their 2 vaccines and has the paperwork to prove it, will they still be required to go into quarantine when entering the country? Thank you.
All right, with regard to the yellow fever vaccine, so one, your card is one way of actually knowing a specific date when you received your vaccination. Some people can actually remember if they would have had, as adults, if they would have had a vaccine over the last 10 years or so. But as we know, yellow fever, as I said before, a single dose now covers you for your entire life. If you cannot remember whether you had your childhood dose or an adult dose, and you are a member of the high-risk group that I called out, there's no untoward effect that will happen if you have another booster dose. As you know, prior to 2013, persons were asked to have yellow fever vaccines, for example, every 10 years. So that process was in place and there were no adverse reactions from the booster. So that can continue. If you are a high-risk group and you can't recall whether you ever had the yellow fever vaccine, it will be better to take preventative measures than to not have the vaccine at all. With regards to the second question, I believe I answered that a few days ago, but just to reiterate, for now, the quarantine protocol remains in place. Persons coming into the country require PCR 72 hours in advance. They will be required to go from a high-risk country into state or state-supervised quarantine for 7 days and follow that with 7 days of home quarantine. We are continuously looking at the data that is coming out of the studies. So far, out of the AstraZeneca study, there's a suggestion that 67% of persons who actually have the vaccine have a decreased likelihood of having the virus in your nasopharynx based on swabs that were taken during the trial. So that is very good news by way of being able to transmit, not being able to transmit. We are waiting a trial out of Pfizer, which is the other vaccine that has been WHO approved, that is ongoing in Argentina. And once we get all the data before us, we can make an informed decision going forward as to if and when that quarantine period will vary and how it will do so. And of course, we will inform the members of the media and the members of the population as soon as that occurs.
Thank you very much, CMO. We go now to Express, please. Express newspaper.
Good morning, Camille Hunt, Express. Dr. Parsaram, regarding the yellow fever issue, you said there hasn't been a case of yellow fever in this country since 1979. Is this in relation to human infections only, but we have had cases in monkeys since then? Or is the situation with the monkeys something unusual? And do we have any figures of how many have died, just to get an idea of how widespread this might be? What kind of numbers have we been seeing?
Right. So, so it relates to Trinidad is actually listed as endemic by certain countries around the world. Endemic for something we call sylvatic or jungle yellow fever, meaning that the cycle is possibly occurring and continuing in the primate population in the forested areas. So there remains a risk, and there has been a risk for many, many years. This is the first positive that I can note in the last decade or so, at least, from an animal sample. We have had some suggestive post-mortem findings years ago, but they turned out to be negative after it was tested. But we really have to keep a very close eye on it. We have changing population dynamics. We have changing coverages in terms of our yellow fever coverage. As I noted, 89.2% is not where we should be, and we need to get that up. Going from a sylvatic or jungle cycle into an urban transmission cycle requires, one, movement from that jungle locality into the urban setting, and two, it requires that there's an immune naive population. Having the coverages down means that there's some naivety in terms of immunity, and we need to get that up very quickly to protect us from any epidemic that might be forthcoming. We have to look at special populations as well, people that move across different parts of the world coming from the jurisdictions outside of Trinidad. We have noted that yellow fever is present in our neighboring countries of the Americas, so there is presence in the region.
Thank you very much, CMO. And we go now to Wired 868, please.
Hi, good morning. Fayola Bostic, Wired 868. I just two questions of clarification, if I may. The help that the Minister of Foreign Affairs has been speaking about in terms of getting vaccines from India, I'm just wondering if that is in addition to the Vaccine Maitri initiative that the Indian government said it would be making a humanitarian donation to CARICOM. Was Trinidad and Tobago included in that initiative? And are the vaccines you're talking about extra, the one that you're talking about approaching the manufacturer itself? So that's the first question. And the second question, Sima, you mentioned over 923,000 doses of the vaccine that we had. Could you clarify whether you mean that is confirmed from COVAX, that was made to COVAX? Just if you could confirm that, please.
Thank you very much for the question, WAD 868. What I can indicate from the perspective of the Ministry of Foreign and CARICOM Affairs is this. We have received no offer of free vaccine to Trinidad and Tobago from the government of India. We've also received no offer of free vaccine from the government of India via any CARICOM mechanism. We've checked with the CARICOM Secretariat specifically, and we've received no such correspondence. The engagement, and I'm glad you sought clarification, the engagement via the High Commission of India has been with respect to the purchase of Covishield in the amount of 250,000 doses. That has been the focus of the engagement. We are well aware that with respect to two other countries, there has arisen the issue of some sort of free provision. We've received no offer or correspondence from India with respect to the provision of same to Trinidad and Tobago. But based on the media reports and what has already transpired, there are discussions underway, and we certainly do not preclude or would not preclude any additional provision of vaccine above and beyond that which we are seeking to purchase via the Serum Institute.
Okay, so just to clarify the numbers again. So through the COVAX facility, and this is based on a 2-dose vaccine, right? So 2 doses is not, we are not speaking about number of persons, we are speaking about number of vaccines based on a 2-dose vaccine. So we have a total number, COVAX is covering 33% of our population overall, which will give us 923,340. Out of the 33%, they have agreed for 2021 to attempt to give each member state 20% of the allocation, which is 559,600. Of that first 559,600, we are supposedly expecting anywhere between 100 to 118, 120,000 doses as our first tranche of the 20%. So that's a little breakdown in terms of the figures, just to repeat.
Thank you very much. And now we will receive questions from AZP News, please.
Hi, good morning. Praya Harry, azpnews.com. My first question is for the CMO. CMO, the turtle nesting season starts on Monday, March 1st. And beaches are closed from 6 p.m. So I was wondering if, maybe concessions would be made in terms of rollout so that these groups can continue the activities, the conservation groups in terms of the turtles can continue the activities and also earn a bit of income also. So my first question. And my second question is for Minister Brown. Minister, and please forgive me because my internet broke down a little bit. So if you answer this, I just wanted for you again to clarify about the 2,000 vaccines that we received from Barbados and that Barbados got from India. I just want to find out how it is, therefore, Barbados was able to access that facility and not us. Can you explain that? Because there seems to be a perception, right or wrong, that Trinidad is not being as proactive as we should in terms of acquiring these COVID-19 vaccines. Thank you.
So just quickly with the turtle conservation groups, we have received some correspondence at the Ministry of Health, which we are looking at for the Honourable Minister to possibly grant an exemption based on the criteria set out. So that is before the Ministry, and we will communicate with the group that has written to us for the exemption for the turtle conservation groups. Minister Brown.
Thank you. Thank you very much. And yes, your internet is certainly clear enough for the question to be well conveyed. With respect to the issue of whether this country has been proactive or not, I think that has been clearly established, that Trinidad and Tobago has been extremely proactive with respect to the exploration and acquisition of COVID-19 vaccines. As has been established as part of the public record, that we have signed agreements 6 months ago for generous supply of vaccines to the people of this country. I think more recently, and we need to be quite clear, that the epidemic situation in Trinidad and Tobago is very different to that exists in Barbados, in Jamaica, and a number of other countries around us. That is the reality. With respect to the donation or gift, as it were, of vaccines between the government of India and the government of Barbados, that was not a CARICOM arrangement, that was a direct arrangement, the details of which have not been shared at this point. As I said, that does not preclude, that has caused no rift or separation between the government of India and the government of Trinidad and Tobago. In fact, it has been heralded, the fact that Barbados, in the middle of an extremely serious local crisis on their shores, chose to then share that donated amount with other countries such as Trinidad and Tobago, has been heralded as another sign of the closeness that exists within CARICOM and a sign of the strengthening regional integration. But again, I don't want the issue of the gift of 50,000 or up to 100,000 vaccines to one or two countries to preclude the reality that we are talking about the order of over 1 million vaccines over the next weeks and months and during the course of 2021 that we are arranging to receive in this country. So you're talking about different scales of issues. With respect to proactivity, absolutely. The government has been highly proactive, and the vaccine needs of the people of this country are being well administered. I think there's a lot of attention, just due to the sequence, on the smaller amount that has been received by the government of Barbados. But the reality is, all of the countries in the region and all developing countries are currently exploring all avenues for purchase of vaccines. The good news, just to expand on your question, the good news is that additional vaccines are coming on stream as we speak. There are signs that there's improvement in the vaccine technology. Some of the newer vaccines have 1 dose instead of 2 doses. And so in terms of the future horizon for vaccine availability, after some of these bigger countries have begun to satisfy their domestic needs, there will be improved prospects, particularly with the advent of new vaccines and increased supplies.
Thank you very much, Minister. We go to IETV, please.
Hi, good morning. Binami here, IETV News. I have 2 quick questions, possibly for the CMO. With TNT signing up for more vaccines, when can we expect a start date for the vaccination rollout for the rest of the population, essential workers and frontline workers aside? And my second question, CMO, many persons have been calling our newsroom, some from the Hindu community. They're asking, can religious services be held at midnight, given the fact that a lot of religious services, a lot of religious occasions are coming up, and they're wondering if it can be held at midnight, and is there a possibility for an increase in the length of service? We checked the public health guidelines, and there was no information on that. So your answer would be much appreciated. Thank you.
Okay, so the first question is a little bit hard to answer in terms of giving an actual date. What we can say again is that we need to get through our healthcare workers, persons over 60, and those with NCDs as the vulnerable populations. It depends not only on supply, it depends on the uptake of the vaccine, how quickly those people come forward and are vaccinated, and we reach a certain critical mass of those people so that we can move forward with the vaccination program. So I don't have a date for you at this time, but it really depends on a lot of factors. With regards to the services, I think you're speaking particularly about the upcoming Shivratri celebrations by the Hindu community. In terms of our guidelines for places of worship, what we speak to is an occupancy within those facilities of 50% or less. And we do speak to, if you're having a service, that you keep those services to 90 minutes or less at this point in time. I think those celebrations can be held within the realm of those guidelines. I don't think that you can, I think there's enough time. It doesn't stipulate how many times a day you can have a service, for example. So I think it can be held. Of course, bearing in mind that we continue our mask wearing, we try to minimize the number of people that congregate at any given time, and of course look at the length of the services.
Thank you, CMO. We will now field questions from TV6, please.
Hi, good morning. Renessa Cutting, TV6 News. To the Chief Medical Officer, would you be able to say whether persons who have COVID or persons who have had COVID confirmed with the virus, and also persons who have maybe strong reason to suspect that they did indeed have the virus, whether these persons are recommended to have the vaccine? And to the Minister of Foreign Affairs, could you say whether, as a position of foreign policy, whether Trinidad and Tobago would be considering paying it forward, so to speak, when we receive more vaccines, perhaps maybe donating back to Barbados or another small island, considering the difficulties in these small islands getting vaccines?
So with regards to your first question, and we had spoken about persons who have COVID-19, and the guideline is as follows. So if you have a confirmed case of COVID-19, we are advising at this point that you have your vaccine, yes, but you wait a period of at least 6 months before having vaccination from your initial infection, and that's to ensure basically that the acute phase has ended and there are no complications from the initial infection, and then you can have your dose of COVID-19 safely and effectively thereafter. So WHO's guideline as it relates for now is after COVID-19 being positive, you can wait 6 months and then have your vaccine for COVID-19.
Thank you, TV6, for the question. And what I heard was a question with respect to further regifting for the future. Would Trinidad and Tobago consider offering other countries, as we receive improved supply of COVID-19 vaccine? What I can tell you in response to this is that the record of Trinidad and Tobago is a strong one with respect to generosity to neighboring countries. The record is well established. I can go even further afield and offer you an example that when this pandemic first began to materialize in China, one of the first countries to send us a small contingent of personal protective equipment to China was Trinidad and Tobago. And if you fast forward a few months, guess what happened? The Chinese reciprocated and sent to us an even larger contingent of personal protective equipment. So that is a sign of the kind of generosity that Trinidad and Tobago has been well known for. And I can tell you that nothing is currently off the table or has been ruled out. And Trinidad and Tobago will continue its strong record and history of generosity to the rest of CARICOM and other countries. We've had a very good example recently by the government of Barbados, led by Prime Minister Mia Mottley, and I'm confident that there will be other examples of the strength of regional integration on the issue of COVID-19 in the very near future. Of course, the first priority, as has been elaborated by the Ministry of Health and all of the government's ongoing efforts, is to achieve successful arrival of significant volumes of approved vaccine for the people of Trinidad and Tobago. That potential for generosity is certainly available to us.
Thank you very much, Minister. And we go now to a follow-up question. One brief question from Newsday, please.
Good morning again. My question is to the CMO. How many of the vaccines that we're getting from Tobago, from COVAX, will be allocated to Tobago? Has that decision been made as yet?
Okay. No, so we are still in talks at the ministry, and of course with Tobago, to determine how many vaccines will be sent across in the first tranche. But as soon as we get our supply in and we confirm the number, we will make that decision then.
Thank you, CMO. And now we go to Wired 868, please, for a follow-up question.
Hi, morning once again. This question is for Dr. Hines, if he's still around. Dr. Hines, with the issues that we've been having with supply, I'm just wondering if it takes us a long while to get to herd immunity, and also the other countries in the world that are having the same issues that we're having, the poorer countries, the smaller countries, and accessing the vaccine. What does that mean in terms of ending the pandemic itself? Would that be possible without achieving herd immunity through vaccination?
Okay, thank you for the question. Now, the issue of the overall global vaccine supply and the approach to vaccinating the population has been addressed in the outline that we've given of how we intend to protect the various members of the population with the approach that we have engaged upon using the vaccines that we currently have. So while the vaccines that we currently have and are expected to get in the short term are targeted towards protecting high-risk individuals, meaning those who are at risk of severe illness, and high-exposure individuals, meaning frontline staff and individuals that are going to be in circulation and possibly exposed to circulating virus. That approach in the initial instance does a lot to reduce the risk of transmission throughout our population, even ahead of the achievement of herd immunity. Now, one way or the other, the global population achieves herd immunity when there is a pandemic, either through everyone getting the virus or through vaccination programs. We have outlined on many occasions that we would much prefer to have our herd immunity achieved through the vaccination route, and we've made provisions to get that done as far as possible. In the interim, with respect to ending the pandemic, or at least holding it at bay, all of the public health measures really do continue to be of the greatest importance. So it does not mean that while we await the vaccine, the other measures no longer work or no longer valid. They continue to be valid, and they continue to play their role in protecting the population and holding the pandemic at bay. At the end of this historical period, years down the road, when we look back, we will see that the approaches that have been taken have been largely successful in keeping the population safe in advance of herd immunity and maintaining that safety when herd immunity is eventually achieved. But herd immunity by itself isn't the be-all and end-all of the population's protection. It isn't the be-all and end-all of the response to the pandemic. So it needs to be taken in context and borne in mind in the context of the wider response that we are currently mounting and continue to mount. I hope that helps to clarify.
Thank you, Dr. Hines. A follow-up question now from AZP News, please.
Good morning again. I just wanted to follow up with the CMO to the whole issue of the turtle conservationists. They are saying that they wrote the minister, and the minister says that he doesn't have the power to grant that exemption for them to go and do and help in terms of the turtle conservation. Can you shed some more light on that, please, CMO?
Okay, so I think I will have to look into that when I get back to the office, and we'll get in touch with you and give you some clarification thereafter.
Thank you very much. And a follow-up question from TV6 now, please.
Hi. Could one of the doctors outline for us the symptoms of yellow fever, things for persons to look out for, what are the treatment options, and the general outlook for persons who may get infected with this yellow fever, so that we could kind of understand what is the level of threat with this virus?
Okay, yeah, so it is in the release, but I'll go through it. So what we suspect, usually it is very similar to what we expect from things like dengue fever, leptospirosis. So we have fever, headaches, jaundice, yellowing, which is a yellow discoloration of your eyes and skin, mucous membranes, muscle pain, fatigue. Severe symptoms may include abdominal pain, vomiting, bleeding from your gums or any other site of your body, which suggests a decrease in platelets in the blood. So it could present as a very mild viral-like illness in most instances, but in some cases it can be very severe where you have bleeding tendencies, and it can result in death. So again, very similar to dengue, very similar to leptospirosis, can represent any acute viral illness in the first few days. So main signs, fever, headache, joint pains, and of course yellow discoloration of the eyes and possible contact with deforested areas.
Thank you very much, CMO. We have come to the end of this morning's media conference. Just a reminder that today we highlighted the proactive steps that were already taken to secure COVID-19 vaccines for Trinidad and Tobago. And everyone, please remember that we all have a part to play in protecting Trinidad and Tobago from yellow fever and from COVID-19. Please continue to follow all of the new normal guidelines and, of course, wear your mask.